satisfying nursing assistants. Sorry, can you hear me, please?
Yes, I can hear you. I can hear you very well. Go ahead,
all right.
sir.
I've actually been thinking there's no much distinction between satisfying nurse assistants and healthcare, because there was an occasion I had the opportunity to listen to healthcare training, but the kind of training I listened to then was not as thoughtful or as deep as the one we had yesterday. And the yesterday lecture actually opened my eyes deeper to see the distinction between satisfying nurse assistants and healthcare, discipline.
Yeah.
And that is one. Another thing, I got engrossed immediately after the lecture that there is hope for me. As a psychology graduate, I have this passion for health, anything that has to do with health. Even in my postgraduate, I was actually thinking I'm going to go for medical health, dental health, etc., like that. But with what I thought, with what I heard from you saying yesterday, I was like, wow. So there is hope for me in the health department.
Of course.
In summary, you actually dealt with it, and yesterday was a huge blessing to us all, especially to me, because of my personal ambition in the world of health. Thank you.
Thank you so much, Mr. Edward. I appreciate that beautiful feedback. I'm glad that at least we were able to do something yesterday, because network really troubleshooted, but I am glad that you have the passion. Like what I said before, when I started yesterday, I had said that the passion is all we need. And once you are passionate, you and I agree, or you will all agree with me that whatever you have passion in doing, whatever you are happy in doing, you do it well. So if, as we have ventured into the health sector, or as you are actually going to delve deeper into the health sector, I already know that you have a very bright and promising prospects in the health future, in the health sector, because you already have the passion, which is one of the most important things. So that's so beautiful, Mr. Edward. Thank you for that feedback. Madueke Queen, I can see your hand up. Okay, Madueke, please tell us something from what you gathered yesterday. Thank you, Madueke.
Thank you very much. I really appreciate yesterday's discussion. I was able to learn the health. Facility, the home health care, and their duty. And also as a CNN, I was able to learn my duty then. First thing I would do is to report any case to the head nurse or the nurse in charge. I don't need to take laws into my hand. And I also need to care for my clients, because if you did not have passion for your clients, you cannot attend to them very well. So these are the tips that we need to grab.
Thank you so much, Madueke. Thank you. Even though your voice is a bit thin, I don't know if it's network, but I couldn't hear you clearly towards the end, but I was able to pick what you meant. So I'm so glad and happy that at least we have been able to come this far. You have understood it was actually worth the while. So thank you so very much. So who else do we have? I appreciate your interest in the health sector, Madueke. I appreciate your interest, because all along you're following the trainings from MJB management. You have taken a couple of trainings that will help boost your portfolio. And I am really glad that you have the passion and you actually attain greater heights. Thank you so much. So we have 3 other hands raised. Yes, let's see. Who are the people that want to? Patience Gold, please. Patience. Patience Gold. Good evening. Good evening. It's nice to have you.
I'm so sorry. My network was bad.
Yesterday training was very interesting for me, especially because, from my background, my experience so far, I've always just been on that fence where I'm thinking, can I really do care? Will I even be able to, empathize with other people's pain? But I'm just there. But after the training yesterday, I discovered a shift of my mindset, because just understanding the role of caring, of care, and particularly even understanding, the nursing aspects, that distinguishing between what a CNA can do, it just gave me that insight. It gave me that insight that there are different areas of care, right? There are different areas. So it's not even in care, there might even be things that may not necessarily appeal to clinical. It might be people that, like when we talked about somebody wanted somebody to post something on social media, for instance, or just let me through my TV. I'm not a technical person, but within the team, there are people that are also specialized in those kind of
Doing
work.
that.
There are people that are doing cleaning. There are people that are probably, attending to, the activities of daily living, where others are not allowed to even do so. So it kind of gave me that opening that it's something I could do. I will be able to have, carve a niche of where I can, come into, to help. So it's very enlightening. And also I like the ethics of professionalism around the role. So aside from the fact that just even talking about CNA, understanding that it is not the same as, the normal care, that's just all encompassing. Knowing that, the scope of the role, that here you are an aide, and even as an aide, it's not, you are assisting. It's not everything you need to assist on. You can't do drugs. You can't administer injections. You have a scope. And to abide by that scope, it gave me some, relief of focus of just knowing that I know what I'm doing now. So my fear is a bit elevated, and I hope before the end of the class, my confidence will be, soaring to 100%. That yes, I can do this.
Of course, Patience, you can do it. You can do it. See, I tell people that about when we talk about the health sector, like I still say, it starts from you. It starts from you having the mind to help another person. It starts from you feeling bad when you see another person suffering. That's just the thing. If you are someone that has empathy, you have compassion, like see someone suffering, I really get at you. That's the beginning, because you would be able to put in your best to ensure that you help someone that is suffering, someone that is wounded, someone that needs your care. So that's the number one thing before any other thing. So I'm even though I don't know you, but I am 100%, 90% sure that you actually make an excellent certified nurse assistant or a caregiver. So that's very good, Patience. Thank you for your contribution. Mr. Michael, please. Like I said, our scope for today is not too much. We just have to look at most of the things are practicals that we would do when we have the practicals. So we have time to really interact before we delve into what we have. So Mr. Michael, please, the floor is yours. You can ask your question or give your contribution, please.
All right, thank you so much. Yeah, thank you so much, ma'am. Yesterday lecture was quite insightful, and I learned a lot of things. At least it really changed my mindset towards helping others. The introduction aspects, the healthcare, it is well structured, and we were able to understand it. You were able to do justice to it, differentiate. You have to you make all those differences clear. You were able to differentiate between healthcare, CNA from
primary
caregiver,
and so on.
so on. And in the aspect of the ethics too. So I was able to learn a lot of things from the ethics. I really changed my mindset. Thank you so much. I think I really appreciate it, and I'm hoping to learn more.
Thank you, Mr. Michael. Thank you so much for your contribution. I am really glad, because at a point I was worried, like, oh, I just trust that the participants actually got what I did, because yesterday was a bit up and down. So I was really skeptical. But from this feedback, I think I feel happier, and I'm really glad that we're able to learn, to get some things from what we did. So thank you so much. Okay, Hope, I think you are the only one remaining, if I'm not mistaken. Hope, please, the floor is yours. Let's hear from you. Hello, Hope. Yes, I can hear you.
Hello.
Hope. Yes, I
Okay,
can
all
hear
right.
you. Hope. Please go ahead.
Good evening. Good evening,
Good
everyone.
evening.
Sorry, my
Good
name is not Wendy right here. Okay, basically, I don't have much contribution. What I can just say that this CNA program is really insightful to me. And in fact, when you started the program, I was like, how are we going to balance this? When you talk about the caregiver then and the satisfied nurse assistant, the way you were blending everything, I really understand it. And because I have passion in going into nursing, though I'm into health already, but things you've taught us yesterday, and most especially on the ethics aspect, ethics and professionalism, which we also have other ethics. This is things I used to see every day with my patients, but the way you explain it, sometimes you will meet some kind of patient that is very irritable, and you don't know when you begin to transfer aggression. But based on the things you explain and the roles and being empathy towards their illness, a lot of things which is going to help me in future and how to handle some issues, especially when it comes to confidentiality. Once is mental health, once is health aspects, some of things can be confidentiality. So, and how to put things in order and how to organize my things, and how to respect my patient, because those one is very important. Just putting ourselves into their own shoe. If we find ourselves in that situation, it can happen to anyone. Sometimes because some of the patients, so once they hear that there is issue of mental illness or anything health challenges, majority of them might think that is something that cannot be curable, is something they cannot be able to. But the way you explain things is really helped me and is going to help me to know how to navigate some things, especially when I meet those patients that yes, face severe issues, those severe people with schizophrenia that already have this loss of reality, how to deal with them, how to manage them. So based on things you explained yesterday, is going to be an edge to help me to forge ahead and also to forge ahead in nursing later in the future, because
Thank you so very much. Thank you, Hope. Thank you for that.
I also hoping to learn more and to see the end of this program and have the certificate. Thank you.
You're welcome. Thank you so much, Hope. Thank you. You've done justice to that answer. You've explored all avenues. So thank you so very much for that contribution. Do we have any other person? Mr. Abolari? I can see your microphone is on, so I don't know if you had something to say. Okay, if we are done with all the responses, let's get.
I have something to say, please.
Okay. Please go ahead. That's Miss Abidemi. Am I right?
So my name is Martha.
Okay, Martha. Okay, Martha, please.
So thank you so much for the lecture. Yesterday was quite insightful. And yes, I've learned a lot about caregiving and CNA. So while you were trying to differentiate between the caregiving and the CNA, I got to know much about what caregiving actually is all about. Okay, so and then there's one thing I actually took, apart from other things I took today. There's one thing that really got into me, like that I really thought of, like where you were talking about, if you're not patient, if you don't have empathy, you don't have passion for caregiving, for, for people that really needs help. You will
Help,
not,
yes.
I think you actually sounded, you said that this CNA is not for you. You must have patience. You must be patient with your patient.
That's
So that
correct.
got to me because
That's correct.
sometimes we also, let me say, we also have, most of us have things bothering us, right? And then
Okay.
if you want to go into caregiving or you want to go into taking care of others, you must also know that you shouldn't transfer your anger or your aggression to the person. So if you are not happy or if you have anything bothering you, you have to keep it aside when you are with your patient. That's
Of
all I
course.
just, I
Thank
summarized
you.
it. I said, you must keep aside whatever is bothering you when you are with a patient, especially when they would somehow they will get you offended so that you don't
Yes,
transfer aggression to
yes,
them.
that's it. That's it. Thank you so much, Martha. I am glad to hear. You see, these feedbacks have really made my day today. I'm just going to be very happy because I like to see that I impact in people and make them be better in whatever they want to do. So I'm glad to hear that. Thank you so much, Martha. I don't know, maybe we should go into what we have. Do we have any other person that wishes to say anything? Like I said, today we don't have too long talks. Today we may not exceed the we may not get to the 8 o'clock because most of the things that we have under patient care skills are for practicals, like I told you. And as we know, CNA is all about practicals. 3/4 of it is practicals, and then 1/4 is a theoretical aspect. So I just wanted to take this time to palpate your feelings, to get feedbacks from you, and to find out if actually you were able to get anything yesterday. So in the absence of no other person, let's just quickly move into what we have. Like we said earlier, we've had 4 modules so far. We've had 4 modules so far, and the first was Introduction to Healthcare. After the Introduction to Healthcare, like yesterday, we had that too, and then we also talked about what, as a professional, what you are expected to do in your field of your CNA, your duties. Ensure that you don't mix business with pleasure. Ensure that you carry your clients along. You are professional at all times. You keep to the ethics of that particular facility and the policies of that particular facility. And then as a professional, of course, like it applies to all other professions. You have to abide by the rules and the regulations surrounding that. So actually, those were some of the things we did. About anatomy and physiology, we talked about homeostasis. We said that the body already has a way of cushioning effects, already has its own mechanism, the way God created humans, created man. We already have the inbuilt mechanism to be able to balance situations. It's only when you are ill or it gets to the extreme that particular mechanism or those mechanisms will not function effectively. So that is homeostasis. So practically, that's what then we talked about infection control. We did also highlight that it is important that we have to be extremely careful. The little time you take to wash your
Network have started again. I can't hear anything. No.
Yeah, so I can't hear anything, and the slide has disappeared.
Can anybody hear me?
Yes, I can hear you.
It's network. It's bad network. She'll join us shortly, please.
Okay, sir.
So, sorry, we just had a breaking transmission network breach, and when we have network breach, it just goes up. I don't know what is wrong. Please, let's pray that today is going to be hit-free, because it's something I cannot even understand. All right, so please, can everybody hear me? Sorry for that break. I think there was a network glitch, so it just went off. I had to log in again. Are we together, please? Can everybody hear me?
Yes,
Yes, sir, we can hear you.
Okay, there was a little glitch. Sorry, we are going to be having, today is not very favorable, but we just cannot postpone the training. I thought at one point to postpone the training, but it wasn't helping. The network today is not good, but God would help us to handle it. So as I was saying, like before we went off, so patients, now I want to look at patient care skills. There are many things that you need to know as a certified nurse assistant. You need some skills. You need skills that will help you to actually function effectively as a certified nurse assistant. Now, in health settings, it is very important, essential for you to ensure that your patients receive the information and the support that they need to make well-informed decisions. Now, there is something I want to pause at this point to digress a little. There's what we call connection. There's what we call connection. I want us to really understand this. When you connect with someone, it is easier for that person to tell you, to share what his or her challenges are with you. Take, for instance, maybe you don't have a connection with someone, you are not close to the person does not treat you well, you sense that the person does not actually feel what you are feeling, you sense that the person is not actually treating you kindly. It's going to be a problem for the person to be able to really open up to you. So as a certified nurse assistant, some of us can testify. It's just like I gave an illustration yesterday that you can have series of house help, like I have had a couple of them, but I can mention the ones that are close to me. The ones, why? Because they endeared themselves to me because of the way they behave. So what are we trying to say? We talked about professionalism and ethics the other time. It is important that we have to be empathetic towards our patients. That is one of the skills that we need. If you are not empathetic, you cannot be a caregiver, because like I told you, it's not a walk in the park. It's not a walk in the park. Sometimes you hear me say caregiver. So when I say caregiver, don't get it twisted. It doesn't mean that we are in a caregiving training, but what you should understand that anyone that renders care to someone is automatically a caregiver. If you render, like a CNA is a caregiver, a healthcare assistant is a caregiver, a nurse is a caregiver, a doctor is a caregiver, a physiotherapist is a caregiver. You understand? A first aider is a caregiver. So sometimes I may need to say that caregiving. So when you hear caregiving, do not think that I'm referring to the training of caregiving. No, not at all. Anybody that renders care is a caregiver. Even if you have your aged mother at home and you take care of her when there is nobody, you are the one that do the activities of daily living, you assist her with all those things, you are a caregiver. So in this case, sometimes I can be switching in the caregiver. So when you hear it, understand that I mean a certified nurse assistant. So there are certain skills that you need as a certified nurse assistant. You have to be patient. You have to be patient, because what do I mean by patience? Because sometimes you are on schedule to do something. Maybe you have to attend to a couple of things, and a particular person needs your help. It's just like those of us that are Christians. I don't know if it is in the Quran. There's a place they said that if one sheep goes astray, you leave the rest and attend to that one. So figuratively, what I'm trying to say is that the person that needs the most care, don't say, oh, I have 20 people to attend to. Okay. And because of that, I shouldn't attend to this one. Oh, this one is wasting my time. Oh, you are not ready. Oh, you are not this. And you just abandon that person. No. you have to ensure that you carry everybody along. You give special time. You give time, not special. There's time to people. You show them that you respect them. You show them that you value them. You show them that they are not less of a human being. You let them know that it is the condition that they are having that has made them the way they are. It does not affect the individual. It doesn't affect the person. Do not also forget, like sometimes I come across maybe going to visit the hospitals or maybe going around once in a while, I see the way patients are treated in the hospitals. And I just feel, wow, what is happening to the healthcare system? Because most times these people can put up a character, they can put up a behavior that, of course, we are all humans, that if you don't have these particular skills that we are talking about, if you don't have what it takes, you may easily get angry or get offended. Sometimes in a bid of you trying to help someone that is not feeling well or trying to help someone do the right thing, you are doing something good, yes, that you expect to receive accolades, you expect to be, but at the end of the day, the person you are even giving this care to is not receptive, it's not giving you the vibes that you need. It's not making you feel happy. Maybe at the end of the day, you are getting yourself angry. But as a caregiver, you don't, for any reason. As a certified nurse assistant, you are not supposed to get angry, flare up at a client, maybe just an outburst of anger. No. If you are coming to work, that's one of the things we talked about in professionalism. When you are coming to work, prepare yourself. It's one of those things we eventually see as we continue with the modules. Prepare your mind. There is a way people just get your mind prepared. Today, I am going to do something. I'm going to render service to humanity. So whatever I find, the thorns and the thistles on my way, I'll step on them and move forward, knowing that what I am going to do is to serve humanity. And there is no greater thing than that. I tell you, there's no greater honor that someone can be given than to take care of another person that is vulnerable. It's an honorable task. So why am I taking time to say all these things? Like I said yesterday, if your mind is not made up, do not think about the money, do not think about moving for greener pastures. Yes, I know that's good, that's important. But if you think of those things, if you dwell on those things, it will supersede, or it will supersede your actual purpose, your actual calling of which is to be a CNA and to attend to people that are vulnerable. Put in your best in any of those situations, anywhere you find yourself, to lend a hand to the suffering, lend a hand to the vulnerable, lend a hand to the ill, whatever you can do at any time to help alleviate someone's suffering, to help ease the stress of pains or illness that a person actually has, please do it. So practically what we are talking about is one of the most important things that is the bedrock, is a skill. A very important. Empathy makes you to feel what that person is feeling. And when you are empathetic towards someone, you would be able to reassure that person that you actually know how the person feels. For instance, you have a patient that maybe is having, let's say, maybe is having dementia, you understand? So if for dementia, I like to talk about dementia because the rate at which people are having dementia, we have more people really working in the dementia sector, because with age, this dementia thing, it's increasing, is in the increase. So you get to find at least many people that have dementia, have those challenges. So now maybe you have a client that has dementia. On no account should you, maybe you see the person is talking off. You know how dementia patient, maybe the person is saying something that is not supposed to say, or something off. You do not react to that. All you do, because you have the empathetic skill, because you have the patience, because you know what you should look past that particular dementia that the person has. You should understand that this person is a person created by God, and this person is a person that actually had a life. Maybe the person was a teacher in the early years, maybe the person was a sportsman, the person actually had a social life, had a spiritual life, had his life going, and was in control of his life. So you should understand that it is these illnesses that make them, that has metamorphosed, that has made them to actually react the way they do. So if you understand these things, if you are able to separate a person from the illness that the person has, it will make your job easier. It will make your job way, way easier as a certified nurse assistant, because you will be able to move around all the idiosyncrasies, move around everything that you get to see in the line of your duty, knowing that, yes, it's not just this person willingly shouting at me. It's not just this person willingly maybe pouring something at me or backing at me or pouring outbursts at me. It is the factors that have generated, that has made this person behave like this, that this person on his own is a unique person. So if you know these things, it will go a long way in helping us. And you know, as certified nurse assistants, we have to do everything possible to ensure that our clients, our patients are actually doing well. Anything we can do to improve their overall well-being, make them satisfied, alleviate their anxiety, make them to build trust, make them to build that trust. That's very, very important. I've seen situations whereby you see people actually go, maybe they are hospitalized in the hospital, maybe for one thing or the other. And during that period, they have developed a particular bond with maybe a nurse or maybe a certified nurse assistant. They have developed that bond. And you will ask yourself, why? This person they didn't know before. What do you think must have made them to develop that bond that will make them to even remember that person even out of the hospital setting, to make them remember the qualities that that person had? Of course, you know the answer to that. It's because of how well they were treated. It's because of how well that person was able to empathize with them, to give them a shoulder to lean on, to feel their pain, and to understand when it's not all rosy with them. So these are the things that we need to do as certified nurse assistants. We have to understand these things. That's why I took my time to ensure that I really talked about it. It is important. Now, we want to look at examples of some of the skills. These are like the primary skills. For the secondary skills, we are going to look at them in the practicals. That's why that's what I was trying to tell you. Like maybe you for mobility, taking your client for mobility, turning your client on the bed, repositioning your client, maybe conveying your client from the wheelchair to the bed, and all those things. Like I told you, like I still say, that even though it is an online training, I tried to tell a couple of people the other time when they were like, you know, saying it's an online training, what about the practicals? I just smile. I just smile because technology has made it so beautiful. Everything you need to learn, seeing someone physically, you can actually learn it online because of technology, you know, and by that time you get to see these other practical skills. These ones are just practical skills, how to do certain things that are very to dissect the practical aspect and ensure that you understand every part of it when we get to the practicals next week, God willing. So let's look at some of the examples of these patient care skills. We have effective communication. Now, the need for effective communication cannot be overemphasized. Aside the health setting, like I said, this training is actually something you can gift anybody. You can gift to your family members, you can gift to your friends. Why? It doesn't mean that they have to end up as certified nurse assistants. No, it would help them to understand certain life skills that they need to relate day to day with people. It's very important. Now, even aside you being a certified nurse assistant, you agree with me that without communication, nothing can work. A husband and wife without communication, of course not. There's going to be disconnect. In a workplace, if there's no effective communication, there's going to be disconnect. In anything you do, if there is a breach in communication, it doesn't always turn out well. And most especially in the field of being a certified nurse assistant, effective communication is top notch. It's number one. Because there is nothing you do without it. You want to communicate, you communicate with your in-charge nurse. You want to talk, you have to communicate with your patient in such a way that he or she understands what you're actually saying. Your patient has to communicate with you to tell you this is what I want, these are my challenges. Everything dances around communication. So especially in health setting, it is very important that CNAs have to understand, have to learn in being with their clients. Healthcare practitioners should also practice active listening. I must pause at this point. Active listening. Active listening is not just listening. Listening is just, well, yes, you just listen, but active listening involves a calculated effort to understand. That is the difference between just listening to something. You may listen to it actively or passively. You just listen. Maybe because of where your ear is, you just can hear it, and then you listen. Oh, what happened? Okay, you just move. No. But active listening is where you make a calculated effort to pay attention to someone talking, and you try to understand what this person wants. And then you try to paraphrase it in your own words to be sure this is what the person actually wants. For instance, maybe your patient says, oh, I wasn't able to sleep today.
Hello, ma.
Can you hear me? Yes, yes.
Hello, ma.
Yes, please.
Your display
Yes,
is not showing what you're talking to. And
it's
please
showing
help
now.
us put it on
It's
slide
showing.
view.
There's
Sorry.
It's not
See,
showing on
that's
my
why.
own end. Maybe it's my
Thank
network.
you. Thank you for saying that. Like I said, please, you just have to help me, because when there is a fluctuation of network, the slide goes off. So you have to screen share again. Thank you so much for that observation. Because all along, I thought you were able to see.
It's
I thought you
okay.
were able
It can
to see.
show.
Okay, so let's put it in slideshow. Thank you too, as we progress, so that everyone will be able to see it. I hope that's better. Am I right?
Yeah, it's okay.
Okay, thank you. So as I was saying, effective communication is very, very important. Active listening is important. When you listen to your patient, maybe your patient is actually complaining, is actually telling you what his or her challenge is. And even if it doesn't make sense, because sometimes when it has got to do with dementia, maybe they say something that is off, show them that you care, show them that you respect them. That is, show them that they are dignified persons, regardless of the fact that they are having that particular challenge. So active listening is a fundamental aspect, and listen to what the person says. Maybe the person says, oh, I really need to get, maybe I need a cup of water, for instance. Let me just look at that. Please, can you get me a cup of water? And I would like that water to be warm. You know, you listen. After listening to the person, you reaffirm what the person has said, like to say, oh, okay, you need a cup of water. I just needed to confirm. What did you say? Did you say I should get you a cup of water? And the person will affirm. That's a kind of reaffirming what the person has said. Because if you listen actively, you'll be able to understand what exactly your client wants at that particular time. So it's just like a child. I want to give you an illustration. I like to teach, like I told you, I'm actually a born teacher. So I try to digress a little. So maybe a child, you tell a child, go to the kitchen. Maybe I tell my daughter, go to the kitchen, bring me a spoon from the kitchen. And she actually listened to me, but because she was not actively listening to me, she goes to the kitchen and brings me a plate and comes with the plate and gives to me. Of course, obviously, I don't need anybody to tell me that she was not listening to me actively. She just listened and went to do what she wanted to do. So, but if she listened to me actively, to say, oh, mommy, okay, you want me to get you a spoon? Are you saying I should get you a spoon? I'll say, yes, I am saying you should get me a spoon. So that is reaffirming what I have said. And this time when she gets to the kitchen, she will actually get me a spoon. So that's just a layman's interpretation of active listening. So when, as a CNA, it is important that you listen actively. Oh, I must emphasize this. I must say it over and over again. It is very, very important that as we CNAs, as we relate with our clients, we should not take that aspect away from them. We should respect them, because one sign of you showing respect to your clients is to actively listen. Because when someone is talking to you and you are not listening, automatically it means that you don't have regard and respect for that person. It's just a normal day-to-day thing, aside the healthcare sector, you know. So that is practically what we need to do. And also compassionate care delivery too is something that we need to talk about, that we need to look at this point. Compassion, how do you deliver your care? How do you actually deliver your care? Are you compassionate? Do you understand the plight of people? Do you feel their pain? Or do you just do it to fulfill all right? You just do it because you just want to be in the job. Oh, I don't have anything to do. Well, the easy work for me is just to become a certified nurse assistant so that I can make the money and all that. No, if that's the idea or the mindset behind it, then it's about getting to, it's not going to really work out well. So it is important that we render compassionate care. We deliver in a compassionate way. You know, truly understand and acknowledge the concerns of these people, of these patients and needs. What do they need? And of course, I must remind you, like I said yesterday, that a certified nurse assistant is very close to a patient. It's closer to a patient than a nurse. It's closer to a patient than a doctor. The reason is because you do the activities of daily living. You are the one easily reachable. They press the bell, you are the one to come. Maybe they need help, you are the one to come. You are the one they readily and easily see. So if they bond with you, if they have established that connection, it is very easy for you to know what is actually going on with them. That is one very important thing. So we are seen as CNAs, are seen as very important people in the healthcare team. Why? Because that will actually give this care, to the patient, and you are always there. So it's easier to relate with you better than the way they relate more formally with the nurses and maybe with the doctors. Okay, then another thing is collaboration in multidisciplinary teams. What do we mean by that? As a certified nurse assistant, you cannot, like I said yesterday, you cannot take a unilateral decision. You cannot do anything on your own. In the course of this training, a couple of people called me. They were like, are we the same as the nurse? Do we do the nurse duties? Are we nurses? Are we this and that? I've had to answer a whole lot of people because I like to explain. I like to get it all right so we don't get it twisted, So as a certified nurse assistant, you work in collaboration with others. You work in the midst of others. You work with the doctors, you work with the nurses, you work with the pharmacists, you work with a whole lot of people. Everybody work together to achieve the same goal. So with these different specialists, they do their own bid. You do your own bid as a certified nurse assistant. It helps these patients to receive comprehensive, well-coordinated care. Their care is well-coordinated and is comprehensive. Physical, emotional, and psychological needs. Everything works together. Everybody works together. So that is primarily collaboration in this business of healthcare. That is what that particular point talked about. So these are primarily some of the skills, like the major skills that are required in this business of being a certified nurse assistant. So at this point now, I just want us to pause. Like, this is slightly going to be different from what we did yesterday. I would like us to pause, and then I want us to just relax wherever you are seated, maybe with a cup of water or a cup of tea. Just relax, take your time, and watch this particular video that I am going to show you. I like this video so much. I love it because I took time to download it because it helps you learn some things. It helps you learn some things about patients. It helps you learn some ethics, some care skills. And like I like to do my trainings, I like to they say variety is the spice of life. I like to vary it so that you can learn. If you can learn looking at the feet, you can learn through the videos. And then let's see, you are going to learn a lot of things. Take your time and watch, because after the video, I'm going to pause and get feedbacks from you. You tell me something that you have observed and then something that you have learned, like a care skill at the end of the video. So let's just delve into it. But before we do that, I need to find out, are we all together?
Yes, ma, we are all together.
Okay.
Yes, ma.
Thank you.
Yes, we are all
Thank you.
together. Yes, ma, we are here.
Okay, fine. So let's get into the video. Please, I would like to know, I like to carry everyone along. I would like to know if everyone can hear the audio quality, if it's clear enough, and the picture quality for you to see. So when I start it, I'm going to pause at some point to ask for your feedback so that I can then be sure, and then we continue.
Caring for veterans with dementia can be both rewarding and challenging. The VA has developed this training program to help you adopt a more positive approach.
All right, so please, can we hear?
Yes, ma, we can.
Yes.
Yes, ma, we can hear.
All right, fine.
Yes,
So
you can
let's
hear.
take our time and just relax and watch it, and we'll learn a whole lot from it. Let's get back. All right.
Caring for veterans with dementia can be both rewarding and challenging. The VA has developed this training program to help you adopt a more positive approach to address veterans with dementia. In the following scenarios, you will first see a counterproductive way of approaching a veteran, followed by the preferred positive approach of engaging the veteran and addressing challenging behaviors. By learning these positive skills and techniques, you will not only experience better outcomes, you will honor veterans in the twilight years of their lives.
You haven't changed yet? Oh boy, looks like we got work to do. Let me get some things to pretty you up. Okay, now where to begin? No, stop! No, stop! That hurts! I'm just brushing your hair. No big deal. That hurts! Ow! No!
Mom, I think we have an issue here. The video is taken. So I don't know whether it's a network problem or is the setting on the laptop.
Hello, Miss Jones.
Okay, you said the video is cracking.
Yeah, it's cracking.
It is network problem. It is Nigerian
I
network
don't know.
problem.
It's network. It's actually clear from my end, very clear.
No, it's not clear. It's not clear, ma.
Mrs. Jones, would you like to take your hair for makeup?
Who are you?
Okay, I had to pause it. I had to pause the video so that I can ask how many people are having the challenge of it not being clear? Because I can see it very clearly over here. Please, how many people can see the video at least?
It's clear, but it's not. It's cracking. The video
challenge.
My
Okay.
challenge
Mine is cracking too.
Okay.
Mine is cracking too.
Okay,
Yes,
then if it's cracking, then it's the network because my network
It's
is very okay. So let's see. Let's just see. Maybe it may be better this time around. Let's see. Let's see how to go about it. Network is actually bad. It's not my doing. It's Nigeria. We are.
Okay. ID on the line now. ID on
You will
the line.
first see a counterproductive way of approaching a veteran, followed by the preferred positive approach of engaging the veteran and addressing challenging behaviors. By learning these positive skills and techniques, you will not only experience better outcomes, you will honor veterans in the twilight years of their lives.
You haven't changed yet? Oh boy, looks like we got work to do. Let me get some things to pretty you up. Okay, now where to begin? No, stop! No, stop. That hurts. I'm just brushing your hair. No big deal. That hurts. Ow. No. Hello, Mrs. Jones. I'm Angela. Looks like you're ready to get your day started. Mrs. Jones, would you like to fix your hair and put on some makeup? Okay, great. Let's just walk over here so we can find your hairbrush. Here, your hairbrush. Some lipstick. What would you like to do first? Do you want to brush your hair?
Yeah.
Huh?
I like how you're fixing your hair. It looks real nice. What's next?
Please, this video is this time around self is even worse than the first one. Don't know what's the
Okay.
problem.
Okay. All right. I think
Sure, we are going to have the video.
I think what we should do, yes, that's what I was trying to talk about. Let's leave it. We are going to have the video, so you obviously we are going to have the time to go and watch it. I think we should just move. Yes, we should just move. Today's weather is not friendly. The network, I can see it very clear as I'm talking to you. So, but I'm wondering why it's cracking. So it's obvious that we have network challenges. Maybe
Yes,
where you are.
it's
So
clear,
don't
but
worry. Yeah, don't
the
worry.
audio,
The
the
slides.
audio is not clear.
Okay, so don't worry. The slides will eventually get to you, and the video is part of it. So you are going to take your time and watch it. How I wish we could just watch it. You would see that there are a whole lot of skills that you would learn from here that we can discuss. But nevertheless, network is not friendly. So let's just proceed. Like I said the other time, the 2 days we get the training materials after 2 days, like we had before. 2 days, and now we are going to have the next 2 days next week. So by the end of tomorrow, on or before the end of tomorrow, you are going to get the slides for day 1 and day 2, everything I'll let you have so that you can start studying in preparation exams. So now we want to look at vital signs monitoring. This is another very important aspect or duty of a certified nurse assistant, monitoring vital signs. Like we said the other time, that the body, our body is made up of tissues, is made up of structures, is interlocked together, and each one they all do their different duties to ensure that you maintain good health. Yes, please. What about what I'm saying? Can everyone hear me? I hope it was
Yes,
just the. Okay,
Yes,
so
we
then,
can hear you.
so that
We can
means
hear you.
then means audio is not a problem. All right. So as I was saying, our bodies, like God created us. You wriggle your hands, you move your legs. Seriously, most of us don't even, up until I ventured into the health setting, I never thought about how to go about it. Like, I never even thought. I just know I sleep, I wake up, I did not care, just my normal primary basic science that I did in school. And then, but when I now proceeded for higher studies, I now discovered, I began to look at the wonder of a human being, that indeed human beings, we are the way we were created. Your bones, your liver, your kidneys, your urinary system, your excretory system, everything, they do their own duty. So, but if one goes wrong, it affects the other, because all the parts of the body is intertwined together. So, vital signs monitoring is one very important duty of a certified nurse assistant. Like I told you, that I had to take those 2 days to ensure that 3 days rather, to ensure that we dissect all the theoretical aspects. So most of the things you hear me just talk, never mind. When we get to the practicals, it will stick better, because there you will see it, how it is done. You will ask your questions, and it's always beautiful. It's always interactive when we do the practicals, thanks to technology. So, but for now, we want to look at vital signs monitoring, because this is one of the duties. But before we get really into this, though I'm not too happy we couldn't view the video, but let me just say one or two things concerning it. Method of communication is very important. The way you communicate with your clients is very, very important, like we said it earlier on. So if you get to watch that video, if you have any contribution or anything, fine. That's why we have a registered group, please. Like I advise people, if you have any message or anything, private chat me, or you drop it on the registered group, please don't put it in the general group, because anything you put in the general group with the others, I will not attend to it, because already the people that are for this course have been taken out. So if you drop anything that you want to know in the general group, then it's really of no use. I wouldn't be able to help you in that regard. So, but in the registered group, even if it's in the midnight, I wake up to ease myself and I see any message, I respond. I break protocols when I do things. I don't, So at any time, you can drop any message, you can ask me anything. And of course, you can be rest assured that I'll give you the answer that you need. So the way you react, the way you relate with your clients really, really matters. Communication. From that video, you would see that we had the part A, where the lady that came in, the certified nurse assistant that came in, just came in because she was on shift. She had to do a whole lot of things. Oh, is a residential facility. I have to attend to Mr. Paul. I have to attend to Mr. John. I have to go to Mr. Peter. And why are you keeping me? Let me just brush your hair and get this thing over with. Sit down. And she started pulling brushing the hair. And the woman was screaming and shouting. The other one was shouting. She didn't want to be given that. Why? Because of communication, like I tell you, because she lacked the appropriate patient care skill that is needed for her to handle someone of that age and with that particular condition. So she just had the whole thing. And so the lady shouted, but you see, the other lady that came slowly. She knocked on the door first, which is very important. If it is in a room, you knock on the door first. That is important. And you must get the consent to come in, especially for someone that can still express himself or herself, because, some illnesses, they cannot talk. So if it's the one that has speech issue, of course, we'll not be able to tell you can come in, but you knock and then you hold on, you wait a little before you open the door and you enter. And when you enter, you are taking small steps. You don't just enter as if you are going to fight the Third World War, or you are going to, or maybe that day, maybe your husband didn't give you money for feeding, or maybe someone just stepped on your nerves and you are like, oh, it's time for my shift. Let me just go in there and attend to that old lady. If she's not ready, I'm out of there. And all those things. No, it will not really help us. So in this particular, especially if you need to go out in Nigeria, anything goes in this our country. But when you cross the borders of Nigeria and you want to go out, maybe to UK, maybe to all those places, any little thing is termed as abuse. So that's why you have to understand your level of professionalism. You have to make sure that you do not go outside it. You do everything ethically. because if you don't do, there are certain things that you may not intentionally want to do it like that, but it is misconstrued and you find yourself on the other side of the law. That is what I tell people. So like the other caregiver that came, you see, with patience, she gradually took her time, asked her, would you like me to, oh, is this what you would want? Remember, we are talking about preference and we are still talking about skills. Is this what you would actually want? Would you like to freshen up a little? Would you like to put on some lipstick? And because of her approach, manner of approach is very important. Manner of approach is important in all aspects of our lives. The way we approach things is very important. Mr. A and Mr. B may be vying for a particular position, may be asked to go get a particular thing. You find out that Mr. A goes and is not successful, when Mr. B goes and is successful. Why? I know there are certain things, there are certain other factors, but it depends on your manner of approach. Manner of approach, attitude is everything. So if you are able to have the right attitude, you seek your client's consent. Oh, I want you to do this. Like the lady said, okay, I would like this. How I wish it got to the point where we went into the feeding. There's actually the feeding part in the video. Superimpose what she wanted her to eat. Oh, open your mouth. I just need to feed you. Open your mouth. Why is it taking you too long to swallow? And so on and so forth. But the other person came patiently, held her hand, sat down, held her hand, assisted her to pick the spoon, and you saw, obviously, there was a smile on the face of the patient. Tell me how that kind of patient will not be happy to always have you around. And it has the therapeutic effect, because it would even help that person to get better. So please, that particular aspect, I needed to like stress it. I thought we were going to watch the video, maybe network will be friendly so that we'll discuss it. But nevertheless, no issues. Since we are actually going to go to look at it, eventually you will learn a whole lot of things. You see that attitude matters. In terms of the man, the other one just came and pulled the shirt, the buttons, just remove the buttons. Oh, and Mr. Jill, you just have to get ready, get up, try to lift the man up, removing the buttons without the man's consent. At every point, a certified nurse assistant, at any point, whatever thing you are doing with your client or for your client, communicate. When we get to communication skills, you see how very important that is like the heart of being a healthcare worker, whether a CNA, whether a caregiver, whether anything, communication. Because you, and in CNA test, that's one of the things. You may come, they give you a test, they say, come around and show us how to give a patient's bed bath, and you are happy because actually you learned it, you passed through maybe BCC UK or anywhere, you had your training, and you are certified, and you just move with confidence. Okay, I know what to do. I get the bowl, I soak the water, I bring my materials, I do this and do that, and you move and you are doing it and you are happy. But they are the major parts that they are assessing you. One of the major parts that CNAs are being assessed when it comes to tests is in the communication. They want to hear you say, oh, right now I'm going to, you greet the patient. Okay, right now I just want to give you a bed bath. Do you think you can have a yes, or you say no, depending on the situation. Okay, if it's a yes, you say, okay, just hold on while I gather the materials. I'll be back shortly to give you a bed bath. Is that okay? The person has to say yes. So every time, whatever you do, you are cleaning the ear. Oh, I just need to clean the back of your ear to avoid this. Oh, can you just tilt a little? I want to be able to access your back. Is that okay? So that why when you do this, the importance of doing this is it still makes them feel in charge of their lives. You understand? It still makes them feel in charge of their lives. I am always very, very passionate when I talk about this because, like I said, I don't know if I said it yesterday, when I was handling my father, like I said, I didn't have the knowledge as at some years ago when I wasn't in the healthcare sector yet, like fully, I didn't understand this thing. So when my daddy took ill, we were like a military person that was full of energy, full of authority, and commanding people in the barracks, in the battalion, and so on and so forth. All of a sudden, sickness relegated him to the background. He became the way he was. And we didn't understand because we didn't have the right knowledge. So we were busy helping him everything. He wants to stand up, we'll help him to stand up. He wants to do this, the things that he can even do. We don't even allow him to do it because of the love we had for him. And we're like, oh no, Daddy, we don't want you to stress. But at the end of the day, one of the times my father told us that we don't allow him to do the things that we want him to do. Is it because he has become like this? And it wasn't, and it didn't sound well to us because we were busy thinking we were doing something good for him. So there's nothing that kills a person fast, like you taking that person's individuality out of the person, from the person. You are now exercising power over the person. So in a bid for you to ensure that your patients has the right care as a certified nurse assistant, please, communication is important. Informed consent is important. Let them give consent at all points, at all times, as to whatever you want to do. You want to get to the perineal care, which we are going to talk about when we have the practicals. You have to ask, oh, please, this is what I want to do. And as much as possible, let them do the things that they can do. Don't say because you are a certified nurse assistant, okay, oh, this person is just not well, okay, I have to do everything. No, let them still have their individuality. Let them still have control over their lives. All you just need to do is to just lend a hand and you support their preferences. Also taking into consideration that you are working with a team. If their preferences does not suit you in the line with their health, you know exactly what to do. Like a CNA, I told you, you cannot work unilaterally. You have to work with a team. So when you see that there are certain risks, like we talked about ethical dilemmas, when there are certain risks where you want to do risk, rather, when you want to do something good for someone and it's detrimental to the person, you know what to do. Follow the right channels so that it will be addressed properly, so that it will not seem as if the person doesn't have a say or control over his own life, because that is the easiest way to kill people, especially elderly people. So I think with that said, it's important for us to note and understand that we're talking about skills, that these are some of the skills that we'll learn when we have the practicals. And when you watch the video, you're going to learn a whole lot of skills that will help you in this particular profession that God has chosen and given you to do, to serve humanity. So at this point, I don't know if we are together. Are we on the same page? Can I ride on? Can I continue?
Yes, continue.
Yes, please go ahead.
Yes, go ahead.
Continue, ma.
Hello.
Yes, go ahead, ma. We are with you, ma.
Yes,
Have I been saying all these things just to myself? It would have been very sad. So thank Vital Signs. It's one of the things, it's one of the major duties of a certified nurse assistant. Some of us, even before venturing into this profession, you'd agree with me that maybe when you go to the hospital, maybe you take your child to the hospital or you are going to the hospital, the first thing they do is to sit you down. Like when you get the card, you follow the admin processes, they sit you down and do some, check your vital signs, like do a couple of things on you. So that particular duty is actually meant for a certified nurse assistant, checking vital signs. Okay, now, but what's of measurement of the most fundamental functions, physiological functions that reveal a particular information about one's health. Now, why is your vital signs taken? For instance, you may just go to the hospital and you're asked, what's the matter? You say, oh, I've been having malaria. I've not been feeling too well for some time now. And I just want to come. That's why I came to the hospital. So they'll say, okay, fine. They'll give you a seat. You sit down. They'll check your blood pressure. They'll check your temperature. They'll check your pulse. They'll check a couple of things that are important. Why do they check these things? Because these things have got to do with the physiological functions of your body. They need to know if there is any disconnect. They need to, first of all, know, is your blood pressure okay? Is your temperature okay? How are you feeling? How are you doing? They would like to know to an extent to be able to assess your health. So that is vital signs. So now those vital signs, that's why you see them pen it down. If you those nurses that attend to you, see they'll check, put the thermometer, check your temperature. You see them write inside, record it. They'll check your blood pressure. You see them record it. They'll do a couple of things and record. So that is what I want us to understand. As certified nurse assistants, you need to have, like when we have the practicals, you are going to have the right skills that is actually needed for you to do these things. Like you would see them first. This is the theoretical aspect. You get to see them by the grace of God. So now, changing the patient's vital signs frequently during hospitalization is crucial. Checking rather not changing. checking. So it's also your duty to check the vital signs. Okay, a certified nurse assistant, please, can you check the vital signs of of Mr. Peter? Can you check? Let's know how he's doing. Monitor it. So you check the blood pressure, you check a whole lot of things. Why? So that you can observe if there's any unexpected complications, maybe if there's any shots that's rise in the blood pressure or in the pulse or any indication of any serious underlying illness or complication. So now we actually have 5 most critical vital signs. Most critical, most important. We have the pulse, we have the temperature, we have the respiration rate, we have the blood pressure, and also pain. Now, to do your job as a CNA, you need to be able to accurately take those vital signs. Reading, you have to make it actually a specialist, especially a certified one. So you're expected to know how to go about these things, to check all this. I know already, like I said, that we are very seasoned, distinguished professionals on this platform. I know already that some of us, a couple of us, may have a blood, may have the machines in our houses that will check our blood pressure. You know, maybe if you are used to having high blood pressure, you may have the machine where you get to check it. So this is not a very strange topic. I guess it won't be a very strange topic to most of us, even if we are not in the health sector. So let's proceed. So the 4 vital signs. The first is the pulse, the heart rate. It's very important that you check the heart rate of a patient. You know how the heart beats, the normal, because how can you know? First and foremost, you have to know what is normal. In the heart rate, we have the adults 60 to 100 BPM. We have the children, they have their own normal heart rates. We have the pulse rates as well. You have to check the pulse points, which I will tell you that we are going to get to that. When we have the practicals, we are going to look at the pulse areas. You are also going to take part in the practical sessions too. You are going to check and ascertain and know the pulse areas in your body. There are places that are pulse areas in the human body. That's why we talked about the anatomy and the physiology. So when you know that, yes, you can easily, even when a person is ill, when a person is faint, like is weak, you can easily know where to reach out immediately to know whether that person, how is the pulse? You can feel the pulse. Is the pulse weak? Is it weak or is strong? So these are things that we need to know. These are the theoretical aspects. So we are just going to brush them up until next week when we'll have the practicals, where we have the machines, and then you have to see it one-on-one and you understand based on the readings. So we also have, and their pulse areas, we have the radial pulse, which is on the wrist, we have the carotid, we have the brachial, we have different types of pulses, places of pulses, pulse points in our body. Now, what is the procedure for assessing pulse and heart rate? You palpate the pulse, you count the pulse rates, you assess the pulse quality, and then you document the findings, the quality. Is it weak pulse? Is the pulse normal? Because if it's normal, fine. That's why you see that nurses or nurse assistants move rounds. When they are doing their rounds, they come, they say, oh, we would like to check you. They tell the patients, we would like to check you. We want to check your pulse. We want to check your temperature and to know how you are today. Are you feeling good? You say, yes, I'm feeling better. Okay. So you see them do the normal checking, so that they'll be able to ascertain if you are actually recuperating, if you're actually recovering, or if your situation is getting worse. It is these vital signs that will help you. And when you check the vital signs, you also ensure that you are document. This is very important. Then we've talked about the pulse rate and the heart. Now I want to look at respiration. That's another very important part of vital signs, respiration, the second one. Now, in respiration, you measure the number of breaths per minute. There are things, there are numbers or figures or statistics that is considered normal. So as a certified nurse assistant, when you know these things, anytime you're asked to check vital signs, because you are certified, you should be able to know that, oh, so number, oh, why is this person having this number of breaths per minute? This is not normal. This is not, there's certainly something wrong. And you draw the attention of the registered nurse to it. You understand? So that's why the knowledge is very, very important. For children, we have 12 to 20 breaths per minute. I beg your pardon, for adults, we have 12 to 20 breaths per minute. And then for children, we have 15 to 30 breaths per minute when you are checking for their respiration. So what is the procedure? You observe the patient's breathing pattern. Like you can see there is a machine. It depends on, there are different types of machines, but I just decided to just paste this one, you know, not so that we can at least have an idea of it. So you connect to this, and from the readings, from the lines up and down, for those medical practitioners, they understand what I am saying. For certified nurse assistants, you have to do what you have to do, and the nurse will have to go deeper. You don't have to get too deep. But for vital signs, you have to understand, because without understanding, you cannot know what you're doing. It will be like a farmer going to the farm with a hoe, but doesn't know how to use the hoe, or doesn't know what to do with the hoe. That's how it looks like. So that is why it's important that you have an idea, an overview of these things. So you check for any breathing difficulties, because when you see those that have lungs issues, those that have asthma, those that are asthmatic, those that have one issue or the other concerning their lungs, they have breathing issues, you would know easily from the rise and the fall. You'll be able to understand. And when you check these things, document, very important. When you check these things, please do ensure that you document. And if there's any challenge at any point, report immediately to the registered nurse. I cannot say that too much. I cannot overemphasize it, because you are working under the registered nurse. At no point should you take any decision on your own. If you don't know what to do, ask the registered nurse, because it is unethical for you to maybe use your own initiative to do something and it doesn't work out well at the end of the day. It can cost you your job, because the worst of it is if it does not lie within your job description, your job description. It's going to be a problem for you if you are actually a professional. You go to work as a CNA, certified nurse assistant, anywhere. So heartbeat too, this is very important. I think the first one, what did we talk about? The pulse rate and the heart rate. Okay, this one is also talking about the heartbeats, a temperature this time around. Oh, forgive me, I think there is, just give me a second, there is a mix-up. I think